brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you are just joining us, we are talking about chronic obstructive pulmonary disease, or COPD, and emphysema. Express Care's Dr. Jitka Lom is in studio to answer all of our questions about this topic. Let's check out some of our viewer questions now. Stephen from Jigo asks, how do I know if I have asthma or emphysema?
Right, and that can be a little tricky because there's a bit of a crossover. With asthma, it's a reversible condition, meaning that when those airways clamp down, it's hard for you to breathe. You'll use an inhaler, things will open up, you can breathe again, you're fine. With emphysema, it's not reversible. Inhalers don't really work very well, and it's basically a progressive, slow, pathway of shortness of breath, shortness of breath, shortness of breath. And with asthma, there will often be a lot more coughing than there is with emphysema also. But the way the diagnosis is really made is with a chest x-ray and with some pulmonary function test, which is like a breathing test you breathe into a tube.
Okay.
Yeah.
Alan from Manila asks, why do people with emphysema sometimes have problems with fluid retention and ankle swelling?
Oh, with any lung disease, if you basically have a stiff, let's call it a stiff lung, your heart has to work a lot harder because the heart pushes the blood into the lung. That's how it gets oxygenated. And if your heart has to be pushing against resistance all the time, meaning a stiff lung, the heart starts to get tired, and then that all backs up and you start to get swelling of the ankles and basically congestive heart failure. So people with chronic lung disease will also often have congestive heart failure.
Okay.
Yeah.
Kat from Sinahanya asks, my doctor said for me to walk to help my COPD, but I still get shortness of breath. Any advice?
Yeah, that's really challenging. I think pacing yourself is really important, and really monitoring very carefully, like how many minutes you walked before you got short of breath, taking frequent breaks, and working very, very diligently on your stamina. So taking 15 minutes one day, 16 minutes the next day, like that, just taking baby steps to increase your stamina. And also working with your body. If you're having a bad day, you'll be able to do less, and you just have to accept that. It's a really tricky balance.
It's all about moderation, I guess.
Moderation, yeah. Stretching's very important. Breathing, deep breathing exercises are very important. You can do physical therapy also to help teach you proper breathing.
So maybe yoga would be a
Yoga would be good, but you cannot do a lot of the long standing poses. You have to do very gentle yoga.
Okay.
Yeah.
Let's see. Our next question comes from William from Agate. I've had a constant cough for 6 months. My doctor has heard crackling in my lungs. Is it possible I have COPD?
It sure is. If you have had a cough for that long, you really need a chest x-ray and a TB skin test. We talked about that a while back. But it certainly is possible that you have COPD, and again, a chest x-ray would help us with that diagnosis.
Okay. Mel from Magana Heights, what can I do to prevent COPD from getting worse? Because as we mentioned, there's no cure for it.
No, there isn't. But quit smoking, number one, and stay away from any pollution or burning or cigarette smoke at all. And that includes, sprays and stuff like that in the home. And then past that, there are inhalers that you can use every day for maintenance. There's steroid inhalers, and also an inhaler that kind of opens things up in your lungs, opens up the airways, and that's maintenance. And staying on that always, every day, forever, helps prolong life, and that's been proven. So those inhalers are really expensive, but you've got to be on them because they will extend your life. The other thing you got to do is get a pneumonia shot once after age 60. And then you should have a flu shot every single year to help prevent infections. If you feel a little under the weather, take good care of yourself, and stay away from other people who are ill so that you don't convert your chronic lung disease into an acute bronchitis or a pneumonia.
Oh, wow. Okay.
Yeah.
Now, you mentioned something there in passing, something about sprays in the room.
Yeah.
So that can, a lot of people use air fresheners and things like that.
They can definitely trigger. Yep, or even pet dander for some people. So keeping the air very clean is important for you if you have COPD.
Okay, good to know. And Lillian from Santa Rita asks, is there a link between my COPD and high blood pressure and respiratory infections?
A little bit. Sometimes people with COPD have obesity also. That can be one sort of common factor there. And again, as we mentioned, if you have chronic lung disease, it makes you more prone to heart disease also. Also, there's the link of the smoking, right? The smoking made the heart damaged as well as the lungs be damaged. So there's a lot of crossover there. So I think that would be one to really check out with your doctor.
Okay, any last advice for our viewers out there?
Well, it's got to be to not even ever start smoking. to our teenagers out there and our young people, please don't even get into this. Once you've already started the process of inflammation in your lungs, you can quit smoking, but sometimes you cannot reverse the damage that's already been done. So best to never start.
And if you have started, it's never too late to quit.
It's never too late to quit. Yeah.
All right. Thanks, Doc, for coming in. Doc will be back again next week when we are talking about holiday blues busters and New Year's resolutions, which could include not smoking. And don't forget, if you are in need of a great gift idea for that special someone in your life, don't forget you can purchase gift certificates at Express Care on the second floor of the Agana Shopping Center. There is more healthy living still to come. Stay with us.